In Kampala, it was the death of a single nurse that set everything in motion. Suddenly, the entire country was on high alert. How did Uganda manage to end the Ebola outbreak in just 3 months?
Today's May 11th, 2025, and as of April 26th, Uganda officially declared the outbreak over. That's less than 3 months since the first case of Sudan Ebola virus appeared in the capital. So, how did they pull it off? Let's start at the beginning.
Yeah, the very first case. He was a 32-year-old nurse at Malago Hospital. He had a high fever, chest pain, trouble breathing, and, bleeding from several sites. He went to different clinics looking for help, but passed away. Only after the post-mortem did they confirm it was SUDV. That's what triggered Uganda's emergency response.
The numbers tell a lot. 14 cases in total, 12 confirmed in the lab, 2 probable. 4 people died, 10 recovered. And they tracked more than 500 contacts. Actually, 534 exactly.
That's a massive response for just 14 cases. Why did Uganda move so fast? Well, experience. It was their 8th Ebola outbreak since 2000, and the 6th time it was the Sudan strain. They knew what to do. Within just days, national teams were coordinating and rapid response groups were out in the field.
And the contact tracing was really intense. Every single person who might have been exposed was checked on daily. That's 534 people. Each one followed up until they were cleared. Pulling that off in a city as packed as Kampala, that's not easy.
International support played a big part too. The World Health Organization sent over 130 experts, and the CDC was on the ground with Ugandan health teams. They helped with case investigations, lab tests, and, contact tracing.
But it wasn't just doctors and scientists. Anthropologists worked with communities to reduce stigma and build trust. That's often overlooked in outbreak response, right? If people don't trust the system, they might hide symptoms or contacts.
Now, about the science. There's still no licensed treatment for Sudan Ebola virus. But Uganda moved quickly. A randomized vaccine trial started just 4 days after confirming the outbreak. They used that ring vaccination approach, targeting contacts and contacts of contacts.
And they use remdesivir under the Muri protocol. That's emergency use when there's nothing else. The lab work was fast too. Genomic sequencing took less than 24 hours from sample to result.
That sequencing turned up something interesting. This outbreak wasn't a leftover from 2022. Instead, the virus was genetically closer to the 2012 Luwero outbreak. So, was this a new spillover from animals or something hiding in people? The data suggests maybe an independent source.
So what's the lesson for everyone else? First, having experience really matters. Countries that have seen this before can act faster. And outbreaks in big cities are, well, they're very different from rural ones. Kampala's not a tiny place.
International teamwork is still key even when resources are stretched, and building scientific tools like vaccines, rapid sequencing, into emergency plans can make a big difference if the systems are ready.
Dr. Chikwe Ihekwazu from WHO said this outbreak challenged Uganda in new ways. Urban and rural cases, tight funding. But the results are clear. Outbreak contained, few cases, and a model for others to study.
So could this approach be a template for the future? Uganda's shown that with planning, coordination, and involving communities, even deadly outbreaks can be stopped.
Thanks for being with us. Today, we saw how Uganda's quick action and scientific flexibility brought Ebola under control. Now the question is, will others be as ready next time?